All right, we just got done talking about cesarean section and cesarean birth. But today we're going to talk about vaginal birth after C-section, or VBAC, also known as TOLAC. Also, a lot of acronyms in this podcast, so stay with us. Hello and welcome to the New School OBGYN podcast, a podcast in women's health, but for everyone. I just forgot my intro. Our goal is to promote good and reliable knowledge because the source of your information matters. My name is Eric Schumann. I'm a board-certified OBGYN, and today with me again, Dr. Amy Buben.
Hi.
Please consider downloading and following along. We're in all the major podcast hosts, and check us out on YouTube for the video podcast, where eventually I will get video podcasts up. Today, very fun topic as we talk about vaginal birth after cesarean section, which is also known as VBAC, and you'll probably hear us refer to it as that. Kind of the precursor to that is when we talk about somebody attempting that, we use the word TOLAC, or trial of labor after cesarean. And so that's when you're just trying the labor, but VBAC is actually like the process of it happening, I would say. So a couple terms, we sometimes might use them interchangeably. But yeah, as always, we have Dr. Amy Buben here from the University of Washington, University of North Texas for medical school and residency in Fort Worth, Texas, joining us for this talk. And what we'll go over today is what exactly is VBAC and TOLAC, different delivery options you have, and the risks and benefits with each of these options, and what gives you the best success of VBAC. Clinical pearls and FAQ will always be at the end. All right, so we just got over a big talk of C-section and cesarean birth. If someone has had a previous cesarean section, what options does that patient have for their next delivery, Amy?
Well, there are two ways to have a baby. So you could have a vaginal delivery or you could have a repeat C-section. And again, with that vaginal delivery, that's when we talk about trying to have a vaginal delivery, the TOLAC, or the delivery itself, which is considered the VBAC.
So I think a lot of people often, at least in the past, if there's a C-section done, a lot of your future pregnancies would be C-sections. But we found that VBAC can be a safe thing, or having a vaginal birth after a previous C-section. And so why would someone want to have a VBAC or a TOLAC?
So there's a lot of reasons why you might want a TOLAC. One, it's avoiding a major abdominal surgery, which then makes it for an easier recovery, potentially postpartum. If you're wanting to have a big family, oftentimes it's seen as less invasive and less scar tissue with each repetitive C-section, so it can make having more kids potentially a little bit easier. A C-section, again, so you're avoiding the surgery, but you're also avoiding the risks associated with the surgery. So specifically the risk of infection, the risk of scar tissue, the risk of bleeding, although you can have bleeding with a vaginal delivery as well, but the specific bleeding risk to a C-section. Mm-hmm. And then having labor can be beneficial to babies. So the labor process, that squeezing of the baby, that causes natural steroid release, which helps babies' lungs develop. And so in having a C-section that's scheduled and not going through that labor can make it for a little bit more respiratory issues when baby is born. Not necessarily, not a reason to not have a C-section, but there are benefits to laboring for babies.
Yeah, that nice little squeeze out with a vaginal birth sometimes helps. That stress helps babies kind of take those first breaths easier, I guess is the way I would explain it, or I do explain it. So, I mean, that all sounds great, but I guess why wouldn't everyone just plan for a VBAC then?
Well, it's not for everyone. There might be a contraindication, so it might not be something that is safely an option for you. So I know I just said you have two options, but again, some C-sections are done in a way that it wouldn't be safe to have a vaginal delivery, or this pregnancy may have reasons that it wouldn't be safe to have a vaginal delivery. And then there's also reasons moms wouldn't want to have a vaginal delivery. I'll keep going. Reasons
just
moms
rubbing my
don't
hands.
want
I'm getting ready.
Yes. So scheduling. Oh, sorry, I'll step back. So if you've had a C-section, you sort of know what the process of a C-section is. And sometimes going into it, it's easier knowing, okay, I'm just going to have a repeat C-section. I've already gone through this. Scheduling, which sounds a little crazy sometimes, but actually can be really nice to know exactly when your baby's going to be born and you have everything set. It's just a much easier to kind of schedule that. And then not everyone wants to go through labor again, or the risks that are involved with labor when you're attempting a vaginal delivery after a C-section.
So I guess when we're counseling for vaginal birth, trying a vaginal birth after you had a C-section in your previous pregnancy, there's kind of one big glaring risk that we talk about. And we talked about it in the C-section podcast, so catch up on that if you haven't. But there's going to be a scar in your uterus if you've had a previous C-section. And we'll talk a little bit more about types of scars here in a second. But if you have the kind of scar that allows you to have a vaginal birth in your delivery, well, that scar so one thing about scars too is they're not like the normal tissues in our body that have some elasticity to it. Scars are a little more rigid. They don't have that elasticity. So as the uterus is growing through the pregnancy, the uterine tissue is being thinned out. It's being stretched. And during labor, those contraction forces in that muscle of the uterus are putting strain all the way across the uterus to try and push this baby out. But that strain on that on that scar of the uterus, if it's sometimes can be too much, it can start to tear at that scar because, again, it's not as elastic. It has a little more rigidity to it, and it can break. And that's called a uterine dehiscence or a rupture, which can be as scary as it sounds. And can cause some very serious, both mom, but especially baby consequences, and necessitate emergency C-section. That all sounds very scary, but at the end of the day, luckily it is very rare. And so less than 1% of people who undergo a trial of labor after a previous C-section may have this uterine rupture or dehiscence. So pretty rare, but pretty serious.
Yeah, so there's a couple things we do if you're wanting to have a TOLAC or a trial of labor after cesarean. And that's these things we do to make sure that we keep you and baby safe. So one of the things is we recommend doing this in a hospital setting where you can have a C-section emergently if that was needed. So that would mean having an operating room available for a C-section, a physician who is nearby or on site, and an anesthesia team that's also nearby or on site. And it might be worth, if you're wanting to go this route, asking whether the hospital that you're thinking about delivering at is someone who offers vaginal deliveries after C-sections. So always just ask that because not every hospital will offer that.
Yeah, depending on which hospital you plan to have your delivery, there's certain levels of acuity or for things that hospitals take care of. And if they don't have these resources, they might say, hey, no, we don't do VBAC deliveries because of that rare risk. If that does happen, they don't have enough of the right people in the hospital to safely get you and your baby delivered in a quick manner. Absolutely.
And one thing we touched on in one of the other podcasts was we typically will monitor the baby the entire time. So we keep a very close eye on your baby to make sure that your baby's well-being, as they can be one of the first signs to tell us if there might be a uterine rupture. We watch baby really closely, so if there's anything that looks like it might be leaning towards a uterine rupture, we can intervene before that happens.
Mm-hmm. So now that and you talked about the alternative. So now we talked about the vaginal delivery, and after a C-section, and we talked about so you have that option, and we talked about that you can just say, hey, I don't want to undergo a vaginal delivery. I tried once before, or I didn't try. I'd rather just choose to have a C-section. And there are certain people that like the idea of that.
And sorry, on that note as well, if you decide that initially that you would like to have a vaginal delivery and you're in the process of labor, at any point that you say, I don't want to do this anymore, I just want a C-section, that is always a possibility too. So know that if you would like to have a labor and you change your mind, you can always do that.
You can always change your mind back.
Yes.
Yeah. So I do get a fair amount of patients that maybe even had a traumatic birth experience with their previous delivery. And they're like, you know what, I want to try to avoid that as much as possible. And potentially that might include just scheduling a repeat C-section. And that is perfectly fine.
Yep.
So
just talking about who's a good candidate for a trial of labor after a C-section. So I tell people this frequently, but the safest thing is to have a vaginal delivery after C-section. The second safest thing is to have just a scheduled C-section, not even try to labor. The least safe thing is to try to have a vaginal delivery and then end up having a C-section. And so it makes it really hard to say, what should I do? Because if we knew that you were absolutely going to have a successful vaginal delivery, then yeah, that's definitely the safest thing. But if we're not sure and you end up with a C-section, we've already scooted you kind of to the least safe option. Mm-hmm. So there are different indicators that tell us, or that can help decide whether or not you are more likely to have a vaginal delivery. So,
segue to me. Yeah. There's a couple online calculators we could use too, where we plug in these information, but basically, so we're talking about the previous pregnancy. If someone was trying for labor and they progressed to 8 centimeters, and despite giving them medication to help the contractions, unfortunately the cervix continues to not dilate further after hours and hours. Something just wasn't right, whether it was baby size, the pelvis size, it's hard to know. But we call that an arrest of dilation, or arrest in the second stage, which is, when you're completely dilated and unfortunately baby can't come out with pushing. If someone has that history, we might, that would risk factor would make it less likely that they would have a successful VBAC, or trial of labor. And we might be less likely to say, with that risk factor, generally there's a higher chance that it might not happen again. So why would you want, and it's again a patient option, but there's a really good chance that's going to happen again because it happened previously. That to undergo that, and we talked about the worst scenario is to fail another it's to fail a TOLAC or a VBAC. Mm-hmm. And so does that person really want to undergo that? For my patients, if I explain all that to them, and we have this discussion a lot before labor even starts in the clinic, but they still really want to try, okay, yeah, you can try, but just to let you know that your chances are lower, and you might end up with labor and then a C-section, which increases risks a little bit of bleeding, infection, damage to the surrounding tissues, but it's still a collaborative decision.
And if your C-section was for a reason that is unlikely to happen again, so say it was due to baby's heart rate needing to have expedite delivery and they did a C-section, if your baby was breech and they did a C-section, the chances of you having a successful vaginal delivery are higher, especially if you've had vaginal deliveries previously. Mm-hmm. So if you had a vaginal delivery and then you've had a C-section for a totally unrelated cause, your chance of having a vaginal delivery is high because we know you've been able to have a vaginal delivery previously. And the reason you had that C-section was unrelated to the labor course. Mm-hmm. So those patients, we may encourage to have a vaginal delivery. But again, if you don't want to, you don't have to.
Did you say breech too? Like a baby's breech and you have a C-section? Yeah. So those patients haven't tried before, so it's kind of a little more unknown, but they have a little higher chance of success. And so generally for those type of patients, your success rate is high. They did some studies and trying to put a number to success rate for VBACs was anywhere from 80% for good candidates, and that would be like what we just talked about in the ladder, to potentially 50 to 60% for bad candidates, having a chance of a successful vaginal delivery. I think it's also the way that I formulate this decision too with patients is often to how close are they to going into labor themselves anyway. And so it's nice because you can kind of, tailor each of this to the patient's desire. Were you going to say something?
Oh, no, I was going to say that exact same thing, actually, is
Yeah.
that it's not just about your prior C-section, but the actual labor course. So if you come in labor versus you're talking about an induction, that can change the success rate also.
Yeah. So like if a patient comes in labor on their own labor and we don't have to induce it, their risk of that uterine rupture drops even lower, so even lower than that 1%. And I often sometimes make the plan too with my patients if we schedule a C-section for any given day, whether it's before the due date, after the due date, week after the due date, and they have that can have a chance to go into labor, and if they come in their own labor, perfect, and they want to try for vaginal delivery still, they can, or they have the option for C-section at that time is an option. You want to talk about the uterine scars a little bit, since we're a little familiar with it from the C-section podcast?
Yeah, so now that I just told you could have a vaginal delivery or a C-section, there are sometimes reasons that we're going to say you would not be a candidate to have a vaginal delivery after you've had one C-section. And one of the big reasons is if your C-section was done in a way where the incision on the uterus, not on the skin, but on the uterus is up and down. It's called a classical incision. And the uterus, the muscle itself, the lower part of it is, as you were talking about, elasticity-wise, has a lot more stretch to it versus the upper part of the muscle doesn't. And so the risk of rupture significantly increases with labor. This is something that if you had that classical or vertical incision on the uterus when you had your first C-section, I really hope your physician told you, because we would actually recommend a C-section before you had the chance to go into labor.
Yeah. The risk goes so much, the risk is sixfold higher of a rupture if you've had that type of incision on your uterus before. And so because we're trying to avoid labor so much, we may go 3 to 4 weeks before your due date in that situation because that risk is so real of that rupture.
Yep. And just like the prior podcast when we were talking about why we do C-sections, so if you had one prior C-section and this baby is breech, and a version is, you can still do versions when you've had a prior C-section, just on a side note.
Good
but
point.
If the baby is still breech, or if you have that placenta previa where the placenta is over the cervix, babies can't be born through a placenta. If you have another reason why you couldn't have a vaginal delivery regardless, then we, of course, wouldn't recommend a vaginal delivery after C-section.
Right. Yeah. So all the same things still apply if you for trying a VBAC. If you can't safely have a vaginal delivery, you can't try a VBAC.
Now, some people ask, okay, well, I've had 2 C-sections. Can I have a vaginal delivery after a C-section?
Good question.
Yes, you can. I think it's going to be very hospital dependent to even up to 3. There are some hospitals that will have people have vaginal deliveries after 3 C-sections. Yeah. Pretty uncommon.
Oh, but you've seen 3, huh?
Yeah, I've seen
intentional.
Yep.
Oh, okay. Not to say
some places will do it. Yes.
Okay.
But 2, I would say, definitely happens in certain locations. Your risk of rupture is going to increase. It's around 1 in 70, I think. So it's a little bit higher than that, less than 1%.
Not to name an exact number.
It's around that.
1.5%, 2%. 1.5%, 2% chance.
But again, if you've had 2 C-sections, it's fewer places that'll offer a vaginal delivery, but definitely ask your provider and see what your recommendation
there's
is.
Certain situations, like if someone had a vaginal delivery, then they had a breech baby, had a C-section, and then for some reason just chose to have another C-section, and then they have another pregnancy, and they're like, oh, maybe I made the wrong choice last time and I had a C-section. Maybe I do want to try for a vaginal delivery. Maybe that'd be a scenario where if you've had 2 C-sections, you'd be a good candidate I'd say for, still understand the risks. But if you're someone that's failed labor twice or failed labor and then failed a VBAC, please do not try to have another VBAC. It's just setting yourself up for danger. And so I try not to be too projecting but that, it's risky.
Yeah, and I know you probably hear me say this every single time I do a podcast, but our goal is always mom's safety and baby's safety. So the reason we have recommendations is to make sure that everyone stays safe. And
we can make cesarean sections. I mean, it's a birth. It's not an unnatural birth. It's a birth. And so, people toss around the word natural and feel like they have to apply that to one way or the other. But, we're trying to make that as good of an experience for the expecting family. And so, I think there's some discussion to have to try and, buck that trend of thinking that C-section isn't, someone failed and had a C-section. No, it's a birth.
Absolutely. And there's no limit as to how many C-sections you can have.
Good point.
So it's not, you have 3 C-sections, you must end your family now. No, that's not our choice. The amount of children you want is 100% your choice. We are just there to help facilitate that, but also tell you expectations and let you know safety-wise what risks are to having further children. But there's no limit.
Some countries might. Some countries, I think, do have kind of like you've had 3 C-sections, you have to get your tubes tied. Or there might even be providers that might say that. But if you're going to a decent area where, it's a, not a, hospital in the middle of nowhere, like, I don't really think, maybe look for a different provider at that point. I shouldn't say that, but it's your option. Let's briefly touch on induction for VBAC.
Yeah.
Because you can do it. Go ahead.
Oh, yeah. So I know in the induction podcast, we talked a little bit about methods of induction. The misoprostol, the prostaglandins, are something we don't typically use when you've had a prior C-section because of the increased rupture rate. So that leaves us a bit more with that Foley catheter or Pitocin. Pitocin is going to roughly double your risk of rupture. But again, we're talking about less than 1% to less than 2%. So it's not a huge percentage total. The balloon catheter doesn't necessarily have that risk. But just know if you're, 1 centimeter dilated, we're going to talk about a balloon catheter. So if that's something you never wanted ever, that's kind of really where we're going with it.
Well, good. Anything else? That was kind of a nice little talk.
No, I think the biggest thing is just it's a conversation to be had with your provider, and it's combining what you would like to do and safety and risks, and ultimately it's your decision. Yeah. It's
ultimately your decision, and I think sometimes it's definitely having a vaginal birth, like we said, is the safest thing for mom and baby, and it gives a good experience. But please listen to your risks and chances, and don't get stuck too much on one side of the plan. And no plans are fluid when it comes to childbirth. And so, we'll be there to watch over closely.
Yeah, absolutely.
Well. That's it for today. Thank you everyone for listening and following along. If you have any questions or want to give us some recommendations for future topics, go ahead. Send us a message on the YouTube or the email. And as always, the content of this podcast is for informational purposes only. And so if you need medical advice, please contact your provider. Thank you, everyone. Have a good day. Bye-bye. Adios. Hasta luego.